Thank you so much for joining us here. Let's get into this story. An alarming rise in the case of bacterial infections across the country has led to warnings from the National Institute of Communicable Diseases, the NICD. Diphtheria comes with symptoms of a sore throat, low-grade fever, and a sticky membrane in the nose or throat. The bacteria was found in 40 people across the country between January 1st and the 15th. To help us understand more about the infection, I'm joined now by Professor Gottberg, who is Principal Pathologist at the Center for Respiratory Diseases at the NICD. Prof, thank you so much for the time. Really appreciate it. Let's just get a clearer understanding, if you will, please, just with regards to diphtheria. One, is it new? And why is it only springing up now? Or is this something that has been around for quite some time?
Thanks, and hello to the viewers as well. It's almost an ancient disease. It's been prevented. It's a vaccine-preventable bacterial infection, and vaccines are given, up to 6 vaccines are given to our children throughout infancy and then as they get older. And I think it's resurging because vaccine coverage is decreasing. So with COVID and all the challenges that life throws at us, parents aren't going or haven't been going to clinics, and we haven't been catching up. So I think vaccine coverage is down. And as a result, we're seeing this organism and the disease that it causes more commonly. And it was 40 cases since the beginning of last year. So it's been, we shouldn't be seeing any cases and hadn't seen cases for many years. Every now and then we have a sporadic case. But ideally, we would like to see no cases. And that's because it is vaccine preventable. And the vaccine is made freely available to all infants and children throughout the country.
Feels like it's primarily happening within the Southern Hemisphere, particularly across Africa as well. Is that cause for concern? Is it primarily happening in the Southern Hemisphere because of the summer months? Is it seasonal?
No, it is seasonal to some extent because it is spread by respiratory droplets. But its seasonality has almost been taken away because it's vaccine preventable. So no, the reason why it's occurring in other countries in Africa, as well as in Europe, and there's even cases elsewhere in the global north and the global south, as a result of vaccine coverage. So this vaccine is given to infants throughout the world and has been very successful in preventing diphtheria. And in fact, what we're seeing is that because of the pandemic, because of other ructions in people moving and refugees, etc., that where it's difficult to get to vaccines, where people aren't vaccinated or being vaccinated as they should be vaccinated, we're seeing a resurgence of diphtheria.
So is that to say that there should be no concerns or fears or worries about a possible future epidemic with regards to diphtheria?
No, I think we must be worried. I think it's clearly the cases that we've identified in South Africa tell us that we're not vaccinating all our children, that vaccines, what should be happening is that all infants should be vaccinated, that this isn't happening as well as it could be, as well as it should be happening. And definitely we'd like to send out the message to guardians and parents to look at their vaccination cards, to see what catch-up vaccinations are due, what did they miss, go to clinics, and ask questions, get information, and then we're giving messages to clinics and hospitals to do catch-up vaccinations, so those vaccines are given, and we're asking for routine visits to be very easily accessible to our parents and guardians. And then we're giving messages to clinicians at this time where we know that coverage is so low, that the clinicians need to be on the lookout for these cases because we think we're missing quite a few of the cases. I think the Western Cape is seeing a lot of the clinical cases, and that's because they're gaining experience in identifying these cases. And so we want to put out the message to the clinicians, and there's been lots of training and sharing of information with clinicians to make sure that they know what to look for. And that laboratories know how to process these specimens.
Does that have to happen a little bit more than usual, Professor? Primarily because you've got such an anti-vaccination sort of growth, particularly since COVID-19, that has grown not just in South Africa, but really globally.
I think it's part of the reason, but I don't think it's the only reason. But I think there's more questions are being asked people should receive answers to those questions. I think it's also that things are just harder. It's harder to get to the clinics. Maybe it's everyone has these competing priorities in life. And so I don't think it's as simple as that. And I think what we'd like to encourage guardians and parents to do is to remember that vaccinations are so important to protect your children, to protect them from these diseases that we shouldn't be seeing and that can be fatal, and that they should present to the clinics for those vaccines that are scheduled, and not to worry if they've missed any. Just come back to those clinics and tell them, and there'll be catch-up vaccinations.
Yeah, I mean, do you anticipate us seeing a whole lot more of these as well happening, particularly over the next months, years, etc.? Because not so long ago, we were already talking about the human metapneumovirus, HMPV. And so the prevalence seems to be growing of some of these other bacterial diseases, if not infections.
Not really. So human metapneumovirus hasn't increased. It was that in China, they were just doing a really good job of documenting not only that virus, but the other respiratory viruses, because they've set up systems to look at respiratory viruses really well for ongoing monitoring, just like we try to do in South Africa, where we have sentinel surveillance, where you do ongoing monitoring to monitor respiratory viruses. And that's what China was doing. And I think there's been no increase in human metapneumovirus. And it is different, and there's no vaccine. So it's an expected respiratory virus, and like some of the other respiratory viruses, rhinovirus, etc. And there's no vaccine at the moment. Diphtheria is completely different in the sense that there is a vaccine. There is a way to prevent our children from being very sick from this disease or from dying from this disease. And I think the one was information being made available, the Global City of Infectious Diseases institutes being better at sharing data. I think that's really good and it's very informative. That's human metapneumovirus. But for us, for the diphtheria, I think it really is because vaccination coverage is lower. And we in South Africa, as a community, need to recognize the importance of vaccines and why we give those vaccines. It's in order to prevent vaccine-preventable diseases that we know can be fatal.
A call for more and greater vaccinations for South Africa in order to prevent some of these bacterial infections there. And that's the word from Professor Anne von Gottberg, Principal Pathologist then at the Center for Respiratory Diseases. That's at the NICD.